Dr. Marilee Barron and Dr. Nancy Cibulka, thank you for talking with me today about your book, Guidelines for Nurse Practitioners in Ambulatory Obstetric Settings. Dr. Barron, I'd like to start with you. Why did this book need to be written?
Well, we felt that the book was actually somewhat overdue to be written. There has been nothing new since the early 2000s for students to use in learning how to take care of obstetric patients. And we had some challenges in trying to get the right material to our students, and it occurred to us that it was time for us to take up the pen.
So this book, Guidelines for Nurse Practitioners in Ambulatory Obstetric Settings, is unique in many ways. And I know that it includes many unique features that are not covered in other books that take on this subject even more generally. I'll throw it out to both of you. Can you tell me a little bit more about some of these unique features the book covers?
Well, one theme that we've tried to thread throughout most of our chapters comes from our understanding that childbearing is just one part of the continuum in a woman's lifespan. And so we have tried to incorporate health promotion suggestions and risk reduction. I can give you an example of that. For instance, we have a chapter on oral health during pregnancy because of the association between oral health and possible preterm labor and preterm birth. But obviously that's very important in terms of overall health over the lifespan. And in addition, the postpartum chapter is really expanded to help to address postpartum recovery and breastfeeding, and that's an area that's often overlooked. It's almost as if once the child is born, then we're kind of done with our job, but really we're not. We really need to pick up with some continuity and then carry on so that there's some health promotion suggestions and ideas for ongoing health, and we've tried to do that in our book.
And one of the ways that I carried on that theme is in the preconception chapter, there is a discussion of fertility health literacy. And the idea behind that is that your reproductive health is a predictor of your overall health, meaning that the same factors that promote good fertility also reduce cardiovascular risk in men and women. So both of those partners are addressed in the book, and what things that a nurse practitioner can teach them reduce later cardiovascular risk and promote their fertility.